Hello, I'm Roberta Lavin. I am glad to welcome you to the second lecture of this course, Research Questions, Hypotheses, and Clinical Questions. We have 4 learning objectives for this section. First, describe how the research question hypotheses relate to the other components of the research process. 2, describe the process of identifying and refining a research question or hypothesis. 3, discuss how the purpose, research question, and hypothesis suggest the level of evidence to be obtained from the finding of a research study. And 4, discuss the differences between a research question and a clinical question in relation to evidence-based practice. Do you have a question? Did you ever ask yourself why things are done this way or that way in the clinical setting? The research question tests a measurable relationship to be examined in a research study. The hypothesis predicts the outcome of a study. For example, you have an intelligent hunch. Now, this is different than when I was in the government, which we called a swag, which was called a stupid wild blank guess. But we're not talking about that. What we're really talking about here is we're talking about intelligent hunches about the way things should be. The hypothesis may guide the design, the assessment, and the interpretation of your data. It's kind of the bridge between the theory and the real world. And I think we've all had moments when we think that somebody is doing a research study and we, as the people at the bedside or the people in the clinic, will obviously look at the research question and scratch our heads and wonder, how in the world does that relate to anything I do on a daily basis? Hopefully, by the end of this chapter in your book, you're going to have a better understanding of that. What about clinical questions? A clinical question is one that helps you guide your practice. You may want to know what's the best way in preventing central line infections, or you may want to know which type of a mask is better on a COVID-19 unit, and does it matter if you're on a unit? Does it matter if you're in the room? Does it matter if you're on another unit? What is the best type of mask that you should wear? Those are clinical questions. And they are also very important to our practice. The first thing I want you to think about is, how do you develop your research question? And this is important in this class because it's one of your first assignments, is to develop a research question based on the topics that I've given you. This usually begins by defining a specific area. To some extent, I'm going to give you broad areas that you can use. Then you're going to review the relevant literature. Now, what does that mean? And it means different things depending on what you are doing. If you are doing a research study, or even if you're looking at evidence-based practice, you want to start usually with the literature that it's in the last 5 years. I certainly would never suggest you go beyond 10 years, although there may be what is considered seminal works that are older than that. But that's the exception, not the rule. Usually for your classwork, you're looking at 5 years, maybe 10 at the outside. So when you do your searches, make sure that you put a time limit on the literature you're searching. You want to examine the questions' relevance to nursing. This is a nursing research class, so the research you're doing needs to be relevant to the profession of nursing or relevant to your practice. It can be a specific practice area. It may even be relevant to more than one profession in healthcare, and that is frequently the case. It is rarely the case that we're going to do a nursing study that will not impact medicine or will not impact physical therapy or social work or pharmacy. We predominantly work in interdisciplinary teams now, and that makes sure that we're all working together. And then the next thing you want to do is you want to say, is it feasible to do a research study in this area? And that's a really important question, because sometimes what we would like to do is not possible, and it could not be possible for several reasons. It may not be financially feasible, you may not have the resources, you may not have the time, you may not be in a facility or a place where you are going to have enough people to participate in your study. There can be many reasons it isn't feasible, including it may be that you want to do something that might be considered unsafe. For the purposes of this class, I've given you 5 broad topics. So when you're defining the research question, you have to choose an area. And you must choose from one of these 5 areas. Topic 1 is COVID-19, the lived experiences of nurses for COVID-19. This is likely going to get you articles that are very different than the ones that you might get, for example, on topic 2, which is telehealth utilization for people with chronic diseases, congestive heart failure, diabetes, or COPD. You will have a lot more literature for topic 2 than you are going to have for topic 1. And a lot of the literature for topic 2, 3, 4, probably 2, 3, and 5, you're going to find in the professional peer-reviewed literature. At this point, you aren't going to find a lot in the peer-reviewed literature, although there is some for topics 1 and 4, which is going to impact your approach. Topic 3 is racism and the impact on health. Topic 4 is nursing burnout during COVID-19. Topic 5 is, are registered nurses prepared for disasters? Now let's think about your research question. And your book gives you this flow chart, which is nicely done. And the flow chart is talking about disparities in high-risk populations, but it's specifically talking about homeless people or people who are experiencing homeless who have been paroled and the completion rates of their HIV or HPV vaccines. The first thing is that an idea emerged, and they were looking at disparities in high-risk populations. The next thing is brainstorming. Once you have formed your discussion groups that you're going to work with on your research topic, you will need to do some brainstorming. And in this case, through their brainstorming, they came up with some specific questions about how effective is peer coaching or case management improving health outcomes with challenging patient populations. And you can read through what they did for brainstorming, and you can use this as a guide to do the same thing for your chosen topic. They moved on to the literature review, and you will notice that they looked up HIV and HPV as preventable public health problems that disproportionately affect people experiencing homelessness. And then you can look through the other things they looked at in their literature reviews. Now, one of the things I added for you on your Blackboard page is a link to how to do a PubMed search like an expert. And that is really important. Ideally, if you had a class that was a full semester and not 8 weeks, you would have time to work with a research librarian, and that person might be able to help you. That might be a little more difficult in 8 weeks. My suggestion is you try to do your own PubMed search and you follow the guidance in the video. And I suggest that you do this because it is a learning experience and it really does help you learn how to search the relevant literature in nursing. After you've done some of the literature research, you can identify variables or potential variables, and you can identify socio-demographic variables and health variables. And I think that this may very well be the case when you do your literature search for your topic. And then finally, you want a formulated research question. And for each of you this first week, it is just going to be a first draft of your research question. You obviously don't have time to do the brainstorming, the literature review, identify the variables and everything in 1 week. So you're going to do a little bit of brainstorming and then you're going to do a first draft. And know that as the semester proceeds, that you will revisit this and you'll probably edit it and change it, as most of us do when we're doing research. So here's an evidence-based practice tip. A well-developed research question guides a focused search for scientific evidence about assessing, diagnosing, treating, or providing patients with information about their prognosis related to a specific health problem. That gives you a little bit more guidance about your research question and what a well-developed research question looks like. Let's talk a little bit about your literature review and what should be in a literature review. First of all, excellent literature reviews usually require the help of a research librarian. They are experts in library science the way we are experts in nursing. And they are gifted and skilled at finding exactly what you want. If you have time, I always suggest you reach out to one and talk to them. At least they can point you in the right direction. When you don't have a research librarian, it's a good idea to know how to search PubMed and other databases for relevant peer-reviewed literature. And remember, when you're doing this work, you need to use peer-reviewed literature. So literature that comes from journals and has been peer-reviewed. And most journals tell you if they're peer-reviewed, and if they don't, it probably means they aren't. But that will make sure that you have quality research. None of these topics will require you to look for books. We really want you to look at the scientific literature that's published in journal articles. Now, there may be a couple of topics, probably the one on the lived experience of nurses during COVID-19, that may require you to go beyond the peer-reviewed literature and look at some of the popular press to see what nurses are saying. I did provide you here the link, and if you look, you can go to this link for a video on searching PubMed like an expert. You can also go to the University of New Mexico webpage and they have relevant articles that will help you search for literature. And they have articles, they have videos, and they have guides. And I think that you will find those helpful, so I provided a link to those. You need to identify your search criteria to find the relevant studies for your systematic reviews. And there may be plenty of articles on part of your question, but no articles on another part of your question. And this is always helpful in identifying the gaps. But remember, even if there's no, so say you're looking at burnout nurses in the time of COVID-19, and you can only find a couple of articles about this. My guess is you can probably find articles about, a lot of articles about burnout in nursing. You could probably find articles about burnout in medicine and other health professions. And you may even be able to find articles about burnout in different health professions during other types of crisis. And sometimes you just need to be a little bit flexible and then be able to adapt that to your work. And then finally, you need to do a critical appraisal of the criteria for your research questions. So here's some questions, and you can find these in your book, that I would suggest that you walk through even after your first draft. And you probably won't be able to answer all of these after the first draft of your research question, but it's a good idea to think about them. So first, ask yourself, does the research question express a relationship between two or more variables, or at least between an independent and a dependent variable, implying empirical testability? Is your question testable? Then, how does the research question specify the nature of the population being studied? Who is your population? Is your population nurses? Is your population patients that have COPD or congestive heart failure or diabetes? Who is the population you are studying? How does the research question, how has the research question been supported with adequate experiential and scientific background material? So, do you have the experience to do this type of research? I would not worry too much about that right now. That's part of what you were getting in the class. But is there any current evidence that exists? How has the research question been placed within the context of an appropriate theoretical framework? Now, I think frameworks are important, and I think that depending on what you decide to study, you may want to use one or more theoretical frameworks to approach your question. And once you get going, we will have further discussions about theoretical frameworks, how you select one that fits your work, and we can even have discussions about what might work best and what would not work. How has the significance of the research question been identified? You're not going to be to that yet, but you will. Have pragmatic issues such as feasibility been addressed? And that will come much later in your work. Obviously, it's an 8-week class, so no study is really feasible in 8 weeks, but we're going to do what we can do to get you going on the right path. And how have the purpose, aims, and goals of the study been identified? And that will also come later in the semester, and we will talk more about that. And then your hypothesis, which is a declarative statement about the relationship between two or more variables. A hypothesis predicts an expected outcome of a study. So yes, in many ways, this is your best judgment about what the outcome of your study will be. And when we think about this, we want to think of this in terms of either a research hypothesis or a statistical hypothesis. And there's a little difference. A research hypothesis is also known as a scientific hypothesis. It consists of a statement about the expected relationship of the variables. It indicates what the outcome of the study is expected to be. I bet you can guess or give me a good suggestion about what you expect the outcome of a study on burnout of nurses and COVID-19 would be. I don't think it would take a lot of effort for any of you to be able to do that. A research hypothesis is also either directional or non-directional. If the researcher obtains statistically significant findings for a research hypothesis, then the hypothesis is supported. I know this may, at this point in the course, seem confusing. That's okay. When you're learning new language and new concepts, they often seem confusing in the beginning. And as you learn more and you approach the end of the semester, they become clearer. The second type of hypothesis is a statistical hypothesis. It is also known as a null hypothesis. You probably remember that term from your statistics class. It states that there's no relationship between the independent and the dependent variables. If a statistically significant relationship emerges between the variables at a specified level of significance, the null hypothesis is rejected. Rejection of a statistical hypothesis is equivalent to acceptance of the research hypothesis. I would suggest you go back in your book and you highlight these areas and you read them again, and you will come back to them over and over as you go through the semester. And it takes time to clarify this in your thinking so that it becomes a natural way to think. Your textbook also has this diagram, which I think should be helpful to you in this process of understanding and determining the use of hypothesis or research questions. And if you look at this flowchart and you apply it to your area of study, I think it will help you very early on in this process. So obviously you examine the literature review and the theoretical framework, and you're not to that point. But when you get there, your next step will be to assess the primary purpose of the study. And that is where it branches. If the primary purpose is exploratory, descriptive, or hypothesis generating, if the answer is yes, then you formulate a research question. But if the answer is no, then you formulate a hypothesis or hypotheses. On the other hand, if the primary purpose is testing causal or associative relationships, if the answer to that is no, then you assess the prevalence of independent or dependent variables in a predictive statement, testability, and appropriate theory based. But if the answer is yes, and the answer should be yes for all of us here in what we're doing, then the question is it a research or scientific hypothesis, or is it a statistical or null hypothesis? If it's a research or statistical or scientific hypothesis, then you have to ask yourself, is it directional or non-directional? These flowcharts will be handy for you as you work through the process during the course of the semester. So this is a good page to print out and keep keep handy. If you keep it handy, it will make you happy as the semester goes on because it will help you with your process. You might want to stick it to a bulletin board or handwrite it up on a whiteboard or something so that you keep it with you throughout the semester. And then the last piece is clinical questions. Start with PICO components. And you're going to hear a lot about PICO questions, which stands for Population, Intervention, Comparison, and Outcome. And a lot of nurses use evidence-based practice, and they ask clinical questions. In those clinical questions, they always follow a PICO format. So the first thing is you identify your population. This is the individual patient or group of patients with a particular condition or healthcare problem. Then you identify the intervention, which is an aspect of healthcare that is of interest to you, the nurse, or to the healthcare team. Next, you want a comparison. So standard of care or no intervention is a very common practice, or a comparison of two different treatments. A lot of time in nursing, we may compare two different treatments if we know, if we want to know how to prevent infections of a central line. The answer is never to do nothing. That's not even an option, in which case you would have comparisons of two treatments or two procedures. A lot of the time in healthcare, no intervention is not an option, especially with patients who are sick. And then the outcome is you obviously are looking for more effective outcomes. And outcomes are what really matters. And your book gives you examples of these in box 2.3. So I would suggest that you take a look at those. Thank you for your attention during Chapter 2 presentation. And if you have any questions, again, my office hours are listed on the syllabus, and I look forward to meeting each of you and talking with you.